Welcome to the NEI podcast. This is Dr. Sabrina Siegel with the Neuroscience Education Institute. And in this episode, Dr. Stephen Stahl will be discussing the most current research on the changing brain.
So now we can do Q&A. If your BMI is normal or lower than normal, does a further decrease of 1 also cut your risk? Who's got a normal BMI? I don't think so, but I don't know. What if someone with diabetes is well controlled? Does that still increase the risk of Alzheimer's? Yep, it's too late. Too late. You got to prevent diabetes, so far as we know. I mean, it's clear that controlling glucose is really important for all sorts of reasons, and maybe it does slow it down, but the studies did not depend upon whether it was, unfortunately, controlled or not. Are you aware of any research supporting the beneficial use of the NAD supplement? My father asked me this morning. I have no stock in this company, so I have no idea whether it works. I don't know. I've heard about it, so I don't know. I would like to learn more about it. I have an open mind, but I just don't know. Is the vegan diet a good idea for aging brain with MCI or Alzheimer's? Well, as long as you're restricting calories and you're restricting fats and you're restricting carbs, restricting red meats also. What's left? I see. I'm not going to have any fat. I'm not going to have any carbs. I'm not going to have red meat. Oh, it's wine and olive oil. That's it. A wine now. No, it'd be fine. It's just one. There's lots of ways to skin this cat. Does exercise provide similar benefits in children or adolescents as they do in the elderly? Well, it certainly does in experimental animals. So I can't imagine that it doesn't. But of course, it hasn't been good human studies, but in animals it does. Are there any studies on how spiritual practices may have a positive effect on the brain? There are some, and more of it's about meditation than spiritual, and there are positive effects of that. I didn't really review that for this lecture, but yes, it's a good thing. What resources for cognitive effects of CI would you suggest? What is CI? Cognitive impairment. Would you? You're done, Stahl. That's your last lecture. Would you suggest for a healthcare provider with bilateral cochlear inputs? What resources? Well, I basically would say they should do the things that are unrelated but perhaps synergistic, diet and exercise. And of course, to use as much auditory input as you can. Would a beta blocker therapy negate the memory protective effects of exercise? Actually, it would of that one kind of exercise. And so, obviously, there's good reason for giving beta blockers, but it might block that specific one. It might not block remember that was the brief bursts of higher intensity exercise, that it probably would block. But the chronic everyday, it wouldn't block. I wonder if people who are born deaf have an increased risk for dementia. I don't know the answer to that. I think there is some data for that, though, that you might be right. I wonder if people... Okay, do you recommend next one. Do you recommend a multivitamin for older patients? Any other helpful supplements? Well, it seems like, you got to keep your vitamin D3 up. You're taking a statin, so you probably need CoQ. And then what else you need? You need to have your chondroitin for your arthritis, and you need to have your fish oil and daily aspirin. This is before you take drugs, right? But I'm serious. That's the way you do it. Mark Mattson advocates for intermittent fasting as a means to increase brain power, reduce the risk of dementia, and increase lifespan. I actually think there's actually some good evidence for that. And the main thing is because you're more or less decreasing caloric intake in a way that people can do it. People have a hard time, not having that extra piece of cake every night, but if they say every Tuesday, and I believe this is the guy that says 600 calories is the minimum. So basically, starving is 600 calories. If you actually take less than 600 calories a day, you have negative nitrogen balance, you break down muscle. So the next day when you start taking food, again, you start putting it back on. So fasting means 600 calories, okay? And often it should be protein. 600 calories with good protein in it. Sometimes they say there's about 100 calories per egg. Have 6 eggs, 2 eggs for breakfast, 2 eggs for lunch, 2 eggs for dinner, and you fasted. Do congenitally deaf, or this is the same thing. Okay, is there a specific age for starting exercise in order for it to make a difference? Are you screwed if you start after 40 years? I sure as hell hope not! Because that's when I started it again. Anyway, I don't think so. I think that you're more screwed when you actually have such bad cardiovascular disease that you're really having a lot of limitations to your cardiovascular system, and you have dementia, and you have diabetes already. Then it's not so much. I think as long as your brain has some plasticity, you're fine. But if it's starting too late, no good. Can you explain fasting triglycerides and insulin resistance and how to interpret these labs? Well, I'm a psychiatrist. It's not a lipidologist, but basically, you can see that olanzapine-like drugs, clozapine-like drugs will increase fasting triglycerides from the normal level to up to 40 points. 10 or 20 is probably enough to mean that you're changing it significantly, and it will do that within weeks. So what I do basically is I try, when I'm giving atypicals particularly, I'll get a baseline. This is actually the reason why I'm so old, because I've survived assassination attempts that the rest of you get if you don't do this. One of the ways to be a psychopharmacologist and live is to not make people fat, particularly if they're young and good looking. Because what they'll do is they'll fire you, and if they're really mad, because you know why? Because I can tell insulin resistance and triglycerides and 40 pounds of weight gain with my eye, just like that. But if I'm going in and I'm taking somebody, and particularly I'm giving it for a mood disorder, to a high-functioning person who needs to have no somnolence, no sexual dysfunction, and no weight gain, or I'm going to make them angry and they're going to assassinate me if I do this, I get fasting triglycerides. And then I give the drug. And then I actually do it a month later. And I try to do it, because I see patients every month, I try to get that back on the chart before they're in the office again. And so I can talk to them about it. And if they popped up 40 points, I say, party's over. They may have gained 2 or even 5 cosmetic pounds in that month, but it tends to be survival. If you wait 6 months and they've got 20 or 30 or 40 pounds weight gain, that's when you actually have long, decreased life expectancy as a prescriber. So what I do is then also change them. And so I want to watch, because they'll go down just as fast. So the drugs that don't have, there's several drugs that don't have, they're the newer ones, lorazepam, brexpiprazole, and particularly cariprazine are some of the best ones. And if you switch most people to that, they will lose their elevated triglycerides. And then once they're stable, I don't do it much more than once a year. If you correct hearing loss when it's moderate to severe, is there evidence of cortical restructuring, or is it irreparably lost? I think if it's moderate, it is. But if the most dramatic one, as you talk to hearing specialists, is that if you wait, particularly until your 80s, when a lot of people really have bad situations and they have a lot, it's pretty difficult to even use hearing aids. The time to use hearing aids is when you still have plasticity in the brain. Moderate is probably okay, severe is not. Subtle, people who are 60, 65 years old who have subtle high-frequency loss get hearing aids. Suggestions for sleep medication, insomnia, 65 plus years. The ones that work. You can use anything as mild as melatonin. I try to stay away from Z drugs if I can. I also try to stay away from anticholinergics, because this is pretty much poisoning. Trazodone is a favorite. But sedating antidepressants can sometimes work. But it's an art. And I don't mind using a Z drug if I have as a low dose. But I try to use no anticholinergic and a Z dose, and the trazodone is my first go-to. What is the effect of metformin on the aging brain? Well, that's an interesting question. There's some evidence that this is an anti-aging molecule. So just take some metformin, it won't bother you. 500 to 1,000 milligrams. There's some question as to whether it really works in people who just stop aging. It does in animals. It's off-label, so don't do it. You'll be sued. It's a prescription drug. Does remaining sexually active over the age of 65 increase BDNF or reduce the chance of developing dementia? I certainly hope so. It's exercise, so it does, yes. Are all of the benefits of diet and exercise as good starting in midlife as a lifetime? Well, actually, there's not really. First of all, it can work in midlife, and it can reverse stuff. So I don't think you have to do it your whole life. The evidence is that all is not lost for us. Metformin is found to be leading to Alzheimer's disease. So what about adding metformin to reduce metabolic syndrome? I don't know why this said it this way. But yes, metformin is something that you could consider off-label as well as diet and exercise and so forth. That's beginning to get into the weeds a bit. In genomics, we can see variants on BDNF. Is that P-BDNF or M-BDNF? Well, the reality is it's just got a little clip end on it, so it's basically both. It's the part of the BDN molecule that's not clipped off. It's in both. Does bioidentical hormone replacement help memory for women, progesterone for sleep, or estrogen for memory? Does raw turmeric help decrease inflammation? Great questions. I don't think there are good data to tell you what it is. So I don't know myself the answer to that. Could you comment on OTC melatonin for neuroprotective purposes? You know, it's interesting you say that because, pop quiz, what's one of the most pro-melatonergic agents you can take in the world today, but not in this country? Valdoxan, which is agomelatine. And agomelatine has all sorts of data in animals that it's very much neuroprotective. So nobody knows, if you care, what are the mechanisms of valdoxan? They're not just melatonin 1 and melatonin 2 agonists, but they also have 5-HT2C antagonist properties. So it's not clear whether pure melatonin, which is what this question is, will work as well, but it could. So I think it's worth trying, definitely. The problem with melatonin in this country is that if you go to a store, you need about 3 milligrams. There was a study done where they took, I think, 70 or 80 different brands of it, and like half of them had 0, and almost none of them had much more than 1 milligram, and it varied quite a bit, and almost none of them had the 3 milligrams that were advertised. Melatonin's hard to make. Pharmaceutical quality melatonin is really probably only available, to my knowledge, as Circadin, which is basically a French thing. You can import it, but if you really want melatonin, it's hard to make sure that they're getting it. So it's not so much that it's bad or it doesn't work, it's just that if it's not in there, it's not going to work. Does lithium protect against the evolution of cognitive changes in individuals with bipolar spectrum? It may, there's no efficacy. I don't think anybody's actually studied it that way. You would think that you could study people who didn't take lithium in bipolar, but there's a lot of noise out there that it may help stop the evolution of cognitive changes towards Alzheimer's disease. But it doesn't take very much. It's just a small dose. But I'm not sure it's been shown or studied very well in bipolar. It would make sense that it could. Do you think the lack of social interaction contributes to dementia, Alzheimer's, or fast aging? Dr. Oz is always having shows on aging. I think they're good. What is your opinion, Dr. Oz? I'd like to have his bank account. But no, I think that the social is a cause or effect. If you get apathy and Alzheimer's disease, do you stop having interaction, or do you stop interaction and it causes Alzheimer's? It's probably a chicken and an egg thing. So I think that it's hard to force people to socialize when they don't want to do it, but I think socialization lost is a very big tragedy in anybody's life, and I think you can be a child that loses interactions with your peers. Good thing they don't need it. All right? This is all you need in life? Not really. So I do think socialization is a very thing, but I'm not sure if it's chicken or egg. Are there any studies on a ketogenic diet? The most studies have to do with the metabolic stuff, not on the brain stuff. So I don't know of good studies or animal studies that show that it's pro-cognitive, but I'm not sure there's good human studies. Can you speak to the extremists who think that no fat is best when our brains actually need healthy fats and cholesterol, as in avocado, coconut oil, and eggs? Well, I mean, there's, extremes of anything is not good. You know what Benjamin Franklin said? This is kind of in reverse. Nothing in excess, including moderation. So all this diet, fasting and doing less of this, being a fanatic doesn't necessarily help. How much do anticholinergic medications increase dementia risk, and should we reconsider prescribing them for sleep? Yes, we shouldn't use them for sleep. It doesn't necessarily cause Alzheimer's disease that I know of, but what it does, if you're like me and you're old and you're hanging on by your last few cholinergic fibers, the last thing you want to do is give it an anticholinergic and knock them out, right? So it's really the fact that people who are losing their cholinergic system with age and maybe pre-dementia, you will uncover that by giving just a whiff of an anticholinergic. It doesn't necessarily cause the problem, but it uncovers the problem. Effects of alcohol abuse on inflammation and cognition. Does N-acetylcysteine help manage inflammation and cognition? Alcohol abuse does cause inflammation, and of course has all sorts of cognitive problems, including making the brain size smaller because it's toxic alcohol. And acetylcysteine has been looked at. It's not definitive, but it seems to be promising. Is loss of sense of smell earlier in life associated with development of Alzheimer's? Absolutely. So go home. If you can't smell, get a hearing aid and start exercising. It is really, loss of smell is arguably the earliest signs of Alzheimer's disease. Interesting. Is there any evidence of effects on brain function of the new rage, intermittent fasting? Well, I kind of answered that. And I actually think the answer is because it overall decreases your caloric intake, it's probably one way to do it. I work in an eating disorder center. Observations are diets predisposed to eating disorders with or without abnormal BMI cause or are associated with cognitive problems. Low BMI for a long restrained period of time is associated with executive functioning problems. Right. Too little is as bad as too much. Eating disorders do exist. People who have particularly anorexic ones and so forth are not good for you. So over dieting is definitely a problem. I hate to tell you this, but in the general non-eating disorders clinic populations, over dieting is usually not the problem. It's usually, people try for a while and quit, and they're on fads, and they quit, and they yo-yo. More antidepressants and antipsychotics are prescribed for elderly patients. There is evidence of their neuroprotective effects. Is there a role for prophylactic use of antidepressants and of antipsychotics in low doses along with exercise diet? The short answer is no. There is work on, closest answer I could give you is UHR, ultra high risk for psychosis. People that are odd, maybe have a first-degree relative, maybe they really don't have positive symptoms, they haven't had a first break yet, and there's some evidence that you may be able to prevent progression to an overt episode with an antipsychotic. And actually, interesting enough, the studies that I've seen, anxiolytics and antidepressants work just as well, but these studies are hard to do. It's not clear how many of these people are really going to convert to a full psychotic illness without treatment. So it's a subject of current research, but it's too early to advise that. What effect are stimulants on memory, particularly if you lose weight? How about metformin or appetite suppressants? Well, stimulants actually are pretty good for memory, unless, of course, you take methamphetamine and smoke it and blow your brain out. But stimulants will be pro-cognitive in most cases. They're most useful for what we would call fatigue-sensitive functions, because if you have processing speed that slows down because it's now 3 o'clock, 4 o'clock in the afternoon, all of us could use a stimulant right now. We tend to use the caffeine, which is a little more illegal, but stimulants will actually help fatigue-sensitive parameters. It's hard to learn when you're fatigued, and that's why a boost will help that. Does the time of exercise with respect to learning affect it? Exercise before school versus after? I don't know. I don't think there's any evidence that it matters, as far as I know. If hearing impairment increases the risk of dementia, would living in a quiet environment increase the risk? Does anybody know of a quiet environment? Because I want to go there right now. It is probably true that if you have really, I think there are like sensory deprivation chambers that people are put in to be tortured, and I think that kind of a thing is bad. So I think that if you have very low amounts of auditory processing, it is probably bad for you. How do you sort out exercise helps cognition versus those who are healthy can exercise? I do buy animal studies show improvement. Is it chicken or egg? In other words, the reason that the patients have less risk of Alzheimer's disease is not because they exercise, but because something else happened, and they're well enough to exercise. I don't know that that is wrong. I think there may be some of that going on, but until they show me that it doesn't work, I'm going to exercise my ass off. I don't know about the rest of you. But it's possible that it's unrelated. That was very pessimistic. Come on, you make me feel bad about it. Is loss of smell associated with dementia? Yes, I told that. Atypical antipsychotic can affect insulin sensitivity. I told you that. It makes your triglycerides go up. Does this mean we're putting patients at greater risk of developing Alzheimer's? Probably. But the pathway to it is up goes your triglycerides, up goes your weight, up goes your metabolic problems, up goes your cardiovascular risk, then you get diabetes. And if you have diabetes, you have the same risk of having a heart attack as somebody who's had one heart attack has of having his second one, and you haven't had one yet. And then you get diabetes, and then you get Alzheimer's disease. So Alzheimer's disease is kind of down there, and some people don't get it because they die of their cardiovascular illness before they get their Alzheimer's disease. I use a lot of S-zopiclone for sleep issues. I've had great success, but do you feel there's a risk in doing this? No. I'm not hearing anyone mention Lunesta. It's fine. I think people are just kind of, children and elderly, we kind of overly protective about. We want to not whack them with medicines, and we want to be careful. But actually, there should be no problem with that if you actually empirically just monitor it in patients, and many people can get away with that. So Z drugs are not forbidden here at all. And finally, what's the test for chronic inflammation? With cholesterol, triglyceride, glucose are normal. And part of the answer is we don't know. I mean, you can do C-reactive protein, but that's very nonspecific. And you can't get them in the brain. You can't actually measure the inflammation in the brain yet. So it's hard to know what the answer to that is. Are you aware of any natural sources of melatonin? There's a fountain in my backyard that... No, actually, I do not know of any natural sources of it. I don't think it's in any foods that I know of.